record. All right, good afternoon, everyone. Thank you so much for joining us. Today we're going to have a mid-legislative session bill update on Assembly Bill 31 provided by Mark Funkhauser, who is the Regional Behavioral Health Coordinator for the Southern Regional Behavioral Health Policy Board. Quick disclaimer. So the purpose of this bill update webinar series is to provide information that we hope will help stakeholders keep track of the progress, content, and any changes to active bills in the 83rd, 2025 session of the Nevada Legislature, which relate to behavioral health. The content presented here is for informational and educational purposes only. It is not the intention of the regional behavioral health coordinators, their home agencies, funders, nor respective regional behavioral health policy boards to persuade participants to take action or position on any bill included in this update series. A little bit of housekeeping. So this webinar is being recorded. We've got the link here to where I've been posting the recorded webinars to YouTube. I will also go ahead and pop that in the chat while Mark is presenting. Unless otherwise specified, please go ahead and hold questions or comments to the end of the presentation. But Mark, if you want to hear questions as we go ahead and you can stop and ask for questions too. Go ahead and keep your microphone turned off unless you're actively engaging in Q&A. That should be the default setting, but if you ask a question and you accidentally forget to remute yourself, I do reserve the right to mute you just so that we can remove any background noise that may result, which could interfere with other people's ability to speak. Not worried about this group, but please keep all comments, questions, and discussion respectful. And I do reserve the right to remove any participants engaging in any subjectively inappropriate or disrespectful activity. And with that being said, I am going to turn it over to Mark. Mark, go ahead and take it away.
All right. Thank you, Valerie. Welcome, everyone. I'll pull my screen up here. And great. Can you see that okay?
Yes, we can. Thank you.
All right, good. I'd like to welcome everyone. I'm not sure if anybody's knows much about this bill that's on this webinar, but AB 31 is the result of I'm going to try to turn my, sorry about that. Okay. AB 31 is a result of actually several years with the Southern Regional Behavioral Health Policy Board working on this. They started on this in 2022, and I started in 2023. They did not put forth a bill in the last session. So we essentially reviewed the policies and the initiatives and revived the transportation legislation. And you can find the slides whenever Valerie uploads those, and then the overview and the FAQs there will be able to give you more details. So this is non-emergency secure behavioral health transportation. It's different than emergency medical services, obviously, that would be provided by an ambulance. Although a lot of ambulances now and law enforcement are providing that behavioral health transport because there are currently no behavioral health providers signed up under the statute that's existing. And it's also different than non-emergency medical transportation, which would be for healthcare related, health only related, not behavioral health concerns. And so what this bill essentially does, it takes an existing statute that is not being utilized for various reasons, which I'll go into later, but it adds an incentive to pay providers both ways instead of, right now it does not pay for empty transport, which they used to call unloaded miles, when the patient is not in the vehicle. So right now, if let's say a provider was signed up and went out to the rural areas to get the patient, they would not be paid for that trip out there. They would only be paid for the trip once the patient was in the vehicle and back. So we're asking Medicaid, and we actually worked with the state on these details that they were thinking about shoring up this statute that's not being utilized very well anyway. And so they were glad that we actually were looking at it. So we're asking the state to pay for round trip, basically. And then there's another factor here. We're asking for a percentage increase, especially for rural frontier. And also, this will be an extra incentive for statewide services. So we're asking the director to apply for any federal authority necessary to increase by at least 15% the rate of reimbursement for Medicaid for rural and frontier counties. That includes tribal areas in those rural and frontier areas. And then at least 10% for all other behavioral health transport services. That include places like Washoe and Clark County. So as I said, the existing statutes are not utilized fully due to low incentives and inadequate reimbursement, and also the restrictions on the vehicles. We feel like with the extra incentives that it will help alleviate some of those concerns about the restrictions on the vehicles that are required actually for safety, which is necessary. But in talking with the state EMS, they mentioned that that might be one of the prohibitive factors. So we're hoping that the increased incentive that this passes will alleviate some of those concerns with and allow them to invest in those vehicles that have certain restrictions. It's not like a full ambulance restriction, but it's definitely has the ability to have a gurney and to be able to secure people. So law enforcement and EMS right now are the doorway to behavioral health care in Nevada as far as that kind of transport. I guess an individual would be able to take someone as well if that person was not in a crisis or didn't have other needs. But right now it's mostly law enforcement and EMS. So there are serious gaps and barriers existing in the rural and tribal regions due to this limited transportation, these long distances. If you've ever been out in rural frontier Nevada, some places that I work with in the southern rural region, Tonopah, for example, is it's about 5 hours from Reno, and it's really about halfway between Reno and Las Vegas. So and it does not have a hospital. So it's possible that they could be transported to a critical access hospital that in Hawthorne or Lincoln County. But if they were to be transported to Las Vegas, it would be a lengthy trip. So the rural hospitals, and the jails are not really equipped with space, staffing, training around behavioral health, and they struggle with long waits for patients and inmate transfers. Additional factors, these transport costs burden local government and law enforcement and EMS. It takes local law enforcement and EMS out of service and the region with increased overtime budgets and staffing needs. It also puts an increased stressor and burnout factor and turnover for those agencies because they're overworked and underpaid. They're going above and beyond by doing some of these long, transports, and then when these personnel are out of the area, that means they either have to bring other people on to service the area. For example, if an ambulance, say there was 2 ambulances in a smaller rural county, and one of those ambulances is, and they position those in different places sometimes to make them more accessible and ready for emergencies. But if one of those ambulances is out of the area for, say, an all-day trip or even a half a day, then that leaves other people in the area at risk. So this bill, we believe, fills critical gaps by reimbursing both ways and adding a payment for empty transport, and also increases that percentage for statewide reimbursement and extra incentive for rural areas. And so we believe that this investment in adequate, equitable funding in Nevada by improving access to care and services will benefit the whole state. And then we also believe that this will give people access to behavioral health workforce in other areas. For example, I mentioned Tonopah does not have a lot of medical. They don't have a hospital. They do have a private clinic that's open some, and they have a few behavioral health providers, but they would not be able to service anybody with intensive needs and things like that. So this would bring people to the urban areas to give them that support. And it also reduces that burden on local government and enhances providers in crisis care while improving services for everyone. So right now, the current status of this bill, it's had a hearing in Assembly Health and Human Services on February 19th. It passed out of a work session on March 21st. The amendment was for us to move the effective date. Medicaid asked us to move that effective date back to January 1st, 2026 instead of October. We give them time to conduct the public hearing process and things like that that they have to complete for the federal Medicaid process. So it will move to full assembly, hopefully, and but there's a significant fiscal note on this, and it would require a Ways and Means hearing, is what I'm told. And the notice of eligibility for exemption is it does exempt from some of the deadlines, the early deadlines. So, and then this is the fiscal note. It's a little complex. I think the main thing to know is that the bill would result in a total of $338,000 approximately in the new general fund cost in the upcoming biennium. A portion of those expenditures would be for to fund systems changes required for the new services and increased rates. And some of this bill would result in $135,000 or almost 136,000 in new general fund expenditures in fiscal year 26 and a little over 200,000 in 27. And so hopefully the $700,000 portion of that and the additional expenditures would be paid with federal Title 19 funds in the biennium. So in this right now, I mentioned that there's no big precedent for this kind of transport. There is medical transport, and I think Medicaid used some of that medical transport for projections for this bill. And so we believe that this real care and support and transport with the right resources is what is needed for Nevada, and that people in the state deserve to have that access to these services. And here's some references. If you do look at the slides, you can have some links in here. They'll be posted. Here's my contact information, and the board chair is Dr. Kevin Austin Garner, and he's been one of the major players in moving this forward, along with Assemblyman Gregory Hafen, who is also working on this, and he's on the policy board. So that completes my presentation. And I guess, Valerie, if not sure if there are any questions or not. I see you put some things in the chat, so I appreciate that. And
Yeah, so we've got the link to the YouTube channel where this recording and the other mid-session webinar series recordings are or will be posted. Also, the slides that you just saw are uploaded in PDF format. And so while people are checking those out and getting their questions together, I just wanted to say thank you so much, Mark, to you and to your board for bringing this forward. I know this is kind of a tough one, and right now is a tough time to be asking for anything with a fiscal note.
right,
If you guys do have questions, you can either use the raise hand emoji or button. Also, if it's not obviously available. If you go down to the toolbar, there's a circle with three dots that says more. You can click on that and enter something into the Q&A. This is something that's persistent across all rural and frontier communities, and something that even transportation that's appropriate and secure is even an issue in a lot of our urban communities as well, particularly the larger ones like Las Vegas. There were some conversations surrounding that. That I've heard from my hospitals and other healthcare providers in my region that frequently they end up using a flight service to transport behavioral health patients to crisis care because they can't get timely and secure behavioral health transportation at this time. Unfortunately, the flight care is sometimes reimbursed by Medicaid, frequently not, and never reimbursed by private insurance. And so that sticks the healthcare organization and or the patient with really high costs that can cause a lot of problems either immediately or later on down the road.
Yeah,
So,
good point.
any of our attendees, any questions, comments, thoughts?
I think you raised some good points, Valerie, and I think the one thing I didn't go into great detail, but the one pager goes into great detail about this, and some of the research on this project is that people with behavioral health, mental health issues are better served with a different kind of transport than and you mentioned the flight transport, which is a little bit overcompensated, just like yeah, plus the cost, right? And also people that might have mental health concerns may not need to be in the back of a squad car or in a full-blown ambulance. It might provide a different kind of care and transport, and I think that's one of the big um, factors here. And I do want to acknowledge, though, that law enforcement and EMS and other folks who are first responders who are doing some of this work out there, they are increasingly more well trained and a lot of good people doing this kind of work. But we're advocating for this other kind of transport that may actually support them and reduce some of their load in this behavioral health work.
Absolutely. And a couple points on that, just to piggyback off of things that I've heard from my stakeholders over the years. One, not only is it stigmatizing and potentially re-traumatizing to be transported in the back of a law enforcement vehicle, particularly if it's marked as such, right? But also in a lot of our small rural and frontier communities, everyone knows everyone. And so you see, your neighbor is being picked up and hauled off in the back of a law enforcement vehicle. Well, maybe they're being transported for illegal hold or some other thing that, it's really not appropriate necessarily for the use of the transport for the law enforcement vehicle. And then the second thing is I've had conversations with various companies who have tried to come to Nevada and provide this type of service before, but the reason why they haven't been able to do so is because they couldn't make it pencil because there were not reimbursements like what is being proposed in AB 31 in place. The cost of doing business is a lot higher in Nevada in a lot of ways, particularly when it comes to insurance, price of fuel, staffing. Um, we all know that real estate can be expensive. You have to have like some sort of home base to have your company work out of. And then with the Medicaid reimbursements being so low and really only for one part of the service that's provided, they just couldn't make it pencil. I know during your presentation, during your hearing with your board chair, Dr. Austin Gardner, there was some discussion on return on investment. Have you guys been able to find any more information about potential cost savings from other places that pockets of public funds?
That's a good question. We have not I mean, I've studied some national articles and research, but um, it's hard to sift out what is actually happening with regard to behavioral health transport because the local budgets include everything else, and I'm not sure anybody's even tracking that in this state. So I
Yeah.
think that that's one of the most difficult parts of this. And you know, you raise some other issues and some complexities of this. Is like they passed this the statutes, in a previous session, but it's not being. It's a good example of legislation that was passed that's still not quite um, ready to be, utilized. And so we're hoping that this, and even if this passes, as you mentioned, it's a difficult year funding wise to pass things. But if this passes, it's not going to be a panacea. And I would never say that this is the end all be all for the rural areas even, but it's definitely better than what we have now, which is non-utilized statutes that are on the books and out there. So we're hoping that these extra incentives will be an incentive, and then maybe we can even start tracking that and seeing what it's actually costing. So I think that's the hard part right now. We just don't know.
Yeah, absolutely. Well, cool. Last call for questions from our participants. Anyone? All right, seeing none. Again, you can go ahead and download those slides if you haven't already. Mark's contact information is included on those slides. So if you have any questions, please feel to reach out to him and his board chair regarding this bill. We greatly appreciate your time, Mark, and we
Yeah.
hope everybody has a fantastic day.
Thank you, Valerie. Thanks for the opportunity, and thank you all for coming.